Are you preparing for SCA? Maybe you're not sure how to prepare for this exam, you're feeling a bit lost. In this video, I'm going to show you exactly how top scorers prepare to give them an edge so that you can use the same strategy. If you're new here, hi, my name is Dr. Erwin Kwun. I'm on a mission to have doctors lead a fulfilling life. The last couple of years, I've been helping GP trainees to pass the MRCGP exam. Let's dive right into it. A common pitfall I've seen among GP trainees who don't do well is that they don't understand the examination. They might be practicing over and over, but they're not refining their consultation and they make the same mistakes. First thing that you need to be aware is really important that you make sure you understand what is being asked of you so that you understand what is it that you need to do to score well. Most people, when they're preparing for this exam, they're not really understanding the exam, they're just reading things. But what you want to do is read and digest the information. Most people, they learn from their mistakes, which is good, smart thing to do. But you know what the top scorers do? They learn from other people's mistake. That's much wiser, so that you save yourself from making the same mistake. This is why it's so important that you make use of the feedback statement. The feedback statement shows you exactly what are the common mistakes that candidates make, and you can read the explanation details as well. And don't just read it, but study it and digest the information so that when you're consulting, you make sure that you adjust your consultation and reverse engineer your consultation to avoid these common pitfalls. In this video, I'm going to show you an extract of a coaching session where we analyze a case example. So you will see exactly what are the mistakes that the candidates are making, and we analyze it against the feedback statement. Then we're going to look at causes of poor time management. What are the areas that you could work on to refine your consultation so that you can manage within 12 minutes? As you might have seen in these two case scenarios, the performance is going beyond 12 minutes, and that's a major issue. As you can see, the duration was 15 minutes 41 seconds, so way beyond the 12 minutes allocated. Did you think that it was average, above average, or below average? Let me know in the chat box, what did you think? So Ziad said doctor-centered. Divya said below, it was pretty long consultation. Secondly, the patient was speaking. Consultation was average, above average, but complex case. Didn't get to management till quite late. So, do you think this consultation would pass or not? Let me know what you think. Okay, some interesting points here. Yeah. So reading the letter is not a good idea because that's not good use of your time to do that in the consultation. Okay, we'll analyze it in more depth, and then afterwards I'll tell you what I think. So when we analyze this case, it's helpful we look at the transcript. So there are various ways that you can analyze a consultation. Most people, they just watch the consultation and they make some notes. However, if you want to do it at a granular level, you can analyze just the audio, just listen to the audio. And if you want to go a step further, you can analyze the video without the audio. So just watch the patient's response, their body language, watch the doctor's body language, and that will give you a different lens when you're reviewing it. And if you want to go even further, then you break the transcript down. So what the patient is saying, what the doctor is saying, write down the transcript. There are various apps that can do that for you. So you can use apps to do that. And in this session, we're going to analyze a transcript because that will give you more substance as in how this consultation could have been done differently. So in the first video, this consultation starts around 45 seconds. So there's already dead time in the consultation before it starts, because I think the doctor was asking various questions that really didn't go into the consultation well. Yes, you have to talk and try to warm up and build rapport with the patient, but you need to make sure that you do it quickly and effectively so that you are in the consultation straight away. And when the doctor says, "How can I help you?" or "How can I help?" it did appear to the patient, the simulator, that the doctor might or might not have come across the results. Okay, so it's important that if it's something where it's to do with the results or letter, then let the patient know that you've had a look at the record. And then the patient starts saying things like, there's been various things done, and she would like to talk a few things through with the doctor. So she was hoping to have this discussion with the results. Then the doctor says, "Of course, and I know we haven't met before, would it be helpful just sort of recap and a little bit about where you are so far." And if you analyze a patient's response after that, she's not that impressed by the response, because she's saying the patient to the doctor, "Well, yes, if you like. I mean, I'm sure you've got all the notes, but well, it all started." So as you can see, she's thinking this doctor should have got all the information. Why is the doctor asking me to recap things? So it's a balance, as in how much information you gather and also how you discuss this with the patient. So if you've already got the information, let the patient know that you've had a look at the record and you can see where they're at. But to put things in context, you'd like to know what's the understanding so far about what's been going on. So then that would be a better way of approaching it. So then the patient starts going in the scripts. So there's certain things that they will tell in the story, and she starts saying that. So then that talking here, it lasts around 2 minutes 40. This patient is very talkative, and if you let this patient talk about various things, she will keep going. And this is what some GPs might say as a heart sync patient. I don't know if you've come across some of them in your practice, but they're very complex cases, and there's something that's bothering her to an extent where she's very negative in her mindset because of this pain. And you can understand her because she's been living with this for the last 3 years. So that's why it's important to understand where they're coming from, because then you will understand what's going on and why are they responding like they are. So a cue that the patient drops is "My friend Claire, who's got cancer." So this is really important because the case here, it revolves around the concern that the patient feels like there must be something, that's why she's having this pain, and she's so concerned that she might have cancer. So in this case, unfortunately, the doctor did not go in more depth, as in what's happened to Claire and what symptoms she had, and why did the patient think that was similar to what her friend had. Because when you get the parallel and you understand where she's coming from, then you can reassure her, as in why you don't think it's similar to what her friend had. But I don't think that was done sufficiently well. So then the doctor would be say something like, "Would it be helpful if I read out, you haven't received this copy of this letter?" So I think she just used that letter to try and see whether that would be helpful. But actually, it's just a regurgitation of what's been discussed by the gynecologist and the patient at the clinic. So it's probably not going to do anything more to reassure the patient. So reading that was not a good use of time. Okay? So then we get to around 7 minutes 26. At this point, we're getting a bit of progress because the doctor is asking about the antidepressant and how is the pain been. So then you can see that the patient is saying that she wants something to get rid of this pain. And the way that the response from the doctor came was quite frank, and she said it to the patient, to be quite frank. However, it's very negative way of doing it. So if you want to do it in a more positive way, it's better if you say to the patient, by setting the right expectation, letting the patient know that it is difficult to manage this chronic pain, but there's a way that we can alleviate these symptoms so that you can feel better. So you don't really let the patient feel like there's no hope. Because as you can see, the next response from the patient is, oh goodness, well, that really is depressing. You mean you can't offer any sort of painkillers? So it's already like showing like there's not much that the doctor can do. When if you think more positive and be optimistic, there's so many things that you can do for this. And it needs to be discussed in a way where it's more positive, because that will allow you to show your skill set. So then we get to around 10 minutes 38, and the doctor is considering some talking therapy here. And it's interesting how the patient perceived talking therapy, because she said she's had experience before and that other person thought it was all in her head. And it's very telling about the experience that she's had so far. She's not had a good experience with this pain, and she's not getting the help she needs. So then the doctor starts saying that the pain is real and validating it, which is a good way of showing that she's concerned and making sure that the patient feels that her concern is real, and explaining what could be done about it. I think this discussion was too late though. It came around 10 minutes 38. Ideally, you won't have that discussion sooner, because there might be some objection the patient might have about this and how to persuade them. So it will take you time to do that. Eventually, she got there, but it took her a long time to get to that point of solving the problem. So when we look at this case scenario, based on the three domains, data gathering, clinical management, and relating to others, let's focus on the first one, the data gathering. The things that could have been done better here would be how this doctor utilized the existing information and don't regurgitate the letter back to the patient, because that doesn't do anything. It just wastes her time. The second thing here is the psychological or social information. It was not recognized and responded sufficiently. She did it, but not to the extent that's required. So we know what the problem is, but we need to know a little bit more in the patient's mind, as in, why is she connecting this with cancer from her friend, and what's been the experience from her friend, because she has got a second-hand experience from Claire. And if we don't have that understanding, then it's going to be difficult, because she's still worried she's got cancer. So it's important that you think about these three buckets in your history. So first bucket is a medical history, which we have a lot of information about in the medical history, the investigations and what's been done, and the fact that there's no abnormalities. The second bucket here is the psychological. So, the idea, concern, expectation of the patient. And that's really important, because there is some belief that she's got cancer. And the last bucket is a social. So when she tells you about how it's affecting her life, she's not able to go out, and there's probably an element of low mood in there. So when you're thinking about this, it's important that you're able to analyze it objectively and think what could have been done better and what has not been done well. So there is also ineffective approach in the data gathering when she was presented with complex problem. So these complex problem where you might get, it's important that you understand from the patient's perspective and what they're looking for, and go and try to address that. Okay? So first you need to know what's the problem. The problem is she's concerned that she might have cancer, and she's not reassured by everything that's been done so far. And she also, the second thing is, she also wants to get rid of that pain. So when we come to the clinical management here, there is this uncertainty in the patient's mind. She's worried that there's something that's missed. And she says, I think at some point, that I understand the scan is normal, but they're still worried because my friend clear. So when the patient's dropping these cues, it's important that you respond to these cues and find out a bit more. And then when you understand what's going on, then you can solve for that problem. So the problem is that she's worried about this. And it could be that you explain, I've asked you various questions and there was no red flags, and we've had extensive information from the tests and examination, and you've had a third opinion. So at this point, because you've had it for 3 years and we haven't found anything, that is reassuring. However, there are symptoms that a patient can feel that are real, but medically we can't explain it. But as far as the assessment that has been done, everything's been done to make sure there's no signs of any cancer. So I think it's helpful if we focus on how we can help you to live with this pain and make sure that this pain is under control, because right now it doesn't sound like the pain is well controlled. So should we focus on that? So you see how I try and prioritize what we're going to do. So first you have to get the shared understanding with the patient. So the patient is worried about cancer, but you have a shared understanding explaining why you don't think this is cancer and justify, and then you're on the same page. Then you can move forward with the clinical management. So the other thing that was not well done was the time management. In a case where you're having to discuss results or a letter, it's important that you don't take a long time in the data gathering before delivering the results or discussing the letter, because then you won't be able to progress well. Because if you go and recap everything, then it's not a good use of your time. So with the relating to others, there is some circumstances that is quite complex in this case, where the patient's got farm and has got other problems going on, and she's saying that she's not able to go out. So you need to try and account for that. And when you're discussing, you acknowledge the difficulties and make sure that you go and try and solve the problem, taking into account what's the circumstance. For example, the patient already had counseling and she has a perception that the person who did the counseling for she was delusional, then that needs to be readdressed. Okay? So then explanation of the plan needs to be shared with the patient, and to try and see how this could be improved. Are you struggling with your consultation skills? Maybe you need help and you want to get constructive feedback. If you'd like to get help, then click the link down the description below to see whether I can help you. If I can help you, then we can enroll you on the one-to-one coaching program. This case, I think it was below average because the time management was not done well. The use of information, pre-existing information, could have been done better. The patient is looking at your professional opinion. They're not looking at somebody who is just conveying a message or a letter to them. They want your understanding and your professional opinion based on what's been happened so far and what you can do for them. So I don't think the problem was managed well. Let's look at the case 6 now. This one, the time management was much better. You could see that this doctor had a notion of time. She did actually at some point later say, because we haven't got much time, and then try to wrap things up. But still she went beyond the 12 minutes. So tell me, what did you think about this case? Let me know in the chat, share in the chat what you think. Do you think this is below average, average, or above? So we've got Divya who said clear pass. Ziad says good. Tom says average. Yeah, so average again, yeah. Okay, so let's break it down. So this consultation, it's a bit difficult to listen because the doctor had some issues with her voice, but she managed to do it though. So it starts around 33 seconds when she acknowledged that the patient booked because they wanted to have a chat about the gynae letter. So you can see that candidate is consulting at a different level. She's already utilized information and putting a context based on her understanding of the briefing and the letter. So then there is this dialogue that goes back and forth about the voice, and then I think the patient thought that she had some problem with her audio, but actually it was a voice. So then the doctor asks, how can I help? And you can see she's using the patient's name. So when you use a patient's name, it's more personal. So I would encourage you use this patient's name as well in your consultation. Don't overdo it, but do it a few times. That helps to build rapport quickly. So then the patient starts saying about she's been waiting to hear or have explained these results, and she's very worried the fact that she's been suffering this pain that won't seem to go away. So you can see this statement from the patient is very useful. When you ask your question, either you want to ask an open question at the beginning, make sure you listen actively to what the patient is telling you, because they will drop cues, and if you pick up on these cues early and then you exploit more, you will find that it's easier, much easier than if you don't really pick up on these cues. One thing, unfortunately, that this candidate does here is that she makes an assumption. I'm not sure if you'd pick it up, but she says something like, you've had this dragging sensation for something like 20 years now, haven't you? So that's not accurate, because she based that based on the depression history, I think. If we go back, you will see this patient had depression diagnosed, anxiety and depression 20 years ago, but this pelvic discomfort has been for the last 3 years. So that's already not a good statement that she's making here, because she's saying things that's not accurate. So you don't want to make any assumption like that. Then around 3 minutes 9, she's exploring for any signs of red flags, showing that she's making a safe assessment here. She's asking about fever, weight loss, and the patient doesn't have any of these signs. Then she actually starts saying about what's been tried, the physio, cream, and the fact that there has been this CT scan. So then starting to discuss about the CT scan. So after that, around 6 minutes 53, she started asking various other symptoms to consider depression. So she's asking about the sleep, whether the patient's feeling depressed or tearful, and the patient has been on this antidepressant, and doesn't look like there has been any improvement in her life. So the patient just saying things like it wasn't really helpful, or she didn't find any benefits from this. So then you have a long discussion that goes back and forth between the doctor and the patient. And the doctor explains that this pain has been quite an issue, and what she's done to rule out serious causes, and also the fact that she's not able to solve it today. So Again here, you want to be truthful with your patient. However, you still want to give them some hope that things can get better. So it could have been done in a different way, where the doctor would say, this problem has been going on for 3 years and it's not something that we will be able to solve in a day. However, there are things I'm thinking that might help. So I can see that various things been tried before, but this has not been tried. So I'm thinking whether you might benefit from a referral to the pain clinic, because they have more expertise as in how to manage chronic pain. Is this something that you'd like? So something positive to give the patient, because this patient, they're going through a downward spiral, and the mood as well is getting lower. And if they're feeling that this pain is affecting them so much, it's going to be more an issue, because pain is subjective. So if she's got the perception of this pain is getting worse and she's not being able to do something, then it's going to get worse. So explaining that vicious circle to the patient might actually help, and explaining how we need to break that cycle. And this is the first step to try things differently this time. So that would be putting something positive on this management. So then at 10 minutes 45, she asks this question: does the pain ever feel so bad that you feel like life isn't worth living, or that you want to harm yourself? Do you ever feel that low? I don't think this is a good question to ask at this point in the consultation. Um, Although it's good that she's thinking about the risk assessment, but you don't want to ask a question at this point. And the patient is a little bit confused and saying it's difficult to judge. But she doesn't seem to be suicidal from the story. So you see that there is jumping back and forth between data gathering and clinical management here. You want to organize your consultation so that you ask the questions for the data gathering. And then when it comes to solving the problem, you actually focus more on solving that problem for the patient instead of finding more problem. So when we look at the three domains for this case, then the problem here is that the data gathering was not systematic, it was not organized. The approach here is not as effective. There were things that could have been done better in the way that she discussed her plan with the patient. So it is a little bit better because she didn't go and recite the letter back again, but she gave her thoughts as in what was done and tried to also rule out other red flags, which is showing that she's making a safe assessment. And she recognized that the dilemma that the patient has been in, and the ways that she actually took the history was more effective because she managed to do more in less time. So when we come to the clinical management here, the time management is still an issue though. As you can see, this is not an easy, straightforward case. This is a patient who has been assessed by various health professionals, and it's very difficult when you've got all these stories and having to piece things together. So it's difficult to manage, but this is where it's important that you get experience of managing complex cases and being more comfortable managing this. And in this case, I think a follow-up would be really important, because you show that you're not going to manage everything today, but you would see the patient maybe in 4 weeks' time, see how she's responding, and discuss what else could be done afterwards, for example. So when it comes to the relating to others, I think communication skills were good generally, and the listening probably not as great, or maybe the way that she comes across by making assumption is not good, because she's saying something like 20 years when we don't really know where she got that from. The other thing here is that the circumstances and relevance of the difference in the consultations, the preference from the patient, and what's been actually happened in the past. That could have been done better in the way that she's discussing the management, because I think both of the candidates here trying to explain about counseling when patient had a really bad experience of counseling before. Then the explanation here, it could have been more shared and adapted to the person's needs. Sometimes we can become very doctor-centered in the way of explaining things. So when we look at this case has been an example, but you need to think from an examiner's perspective, what is being assessed here? So what they want to see here is how well you're able to support, manage, and advise a patient who has got ongoing symptoms of pelvic pain with all physical causes excluded, sensitively and empathetically. So this is going to be a case where you have to use your persuasion skills, your communication skills, and show empathy in the way you can manage this case. Is that making sense so far?
Yes.
Okay, great. Any question about these two cases? So I think the second case that we've analyzed might score higher to the first case, okay? But still, I think it's probably average. There's still a lot of room for improvement. So if you had to do this case, tell me, let's have a discussion. How do you think this patient is feeling about her pain and about the investigation so far? Put yourself in the patient's shoes and tell me what you're thinking. Yeah, I agree. So the patient is probably still not satisfied. So Zayed said, yeah, explore the pain management, what was tried. So why do you think this pain is particularly hard to bear for this patient? So what needs to be very clear here is that pain is subjective. So there is an element of the perception of this patient's pain that needs to be addressed here. It is real, and it's not just in her head because she is suffering from it, and there are things that can be done about it. I think this patient also has a tendency to have a feeling like everything is not right, and she's got some negative thought pattern that's making it even worse. And that needs to be acknowledged sensitively. So yeah, so the psychological worries is definitely an issue, and the major elephant in the room here is worried about cancer. Okay, if that's not addressed, then whatever you say to this patient, she's still going to be worried if you don't readdress that, and whatever pain management you make, it's not going to help her because she's still got this underlying worry about cancer. So that's why you want to readdress the patient's idea, concern, expectation. So her wishes here was clear. She wanted to get rid of the pain, and she wanted to get some answers because that's what she's looking for. She thought that the CT scan would give an answer as in what's going on, and she didn't get that. So this is where it's important that you explain to the patient, especially when there is no answer for them. It's more difficult for them to be able to cope when they don't have a diagnosis or something that's been identified. So what treatment options are possible or evidence-based? What would you have suggested in this case? Tell me. Okay, so pain clinic referral, CBT. So what follow-up would you have suggested here? Do you think this patient would need a follow-up? And if so, what's the reason you would want a follow-up? So I think here, what would have been helpful is to finish strong and explain to this patient that I'm not worried about any cancer. However, if you do have X, Y, or Z, please get in touch with us, because at least then you'd show that you have not completely dismissed their fault, and these are the signs that she needs to look out for. If she's worried that she's getting these, then she can come back. Yeah, that would, being able to know what sort of cancer her friend had would be very helpful in this case. You want to know a bit more about it. So in this case, there were various reasons why these two candidates did not manage to finish on time. So causes of poor time management are usually multiple. Common one is not listening actively. So if you're not listening actively, then the patient is telling their story, and then you won't be picking up on these cues, and you're not going to ask these questions that's going to help you finding out what's going on and get to the bottom of the problem. Remember, in data gathering, your job is to find out what the problem is. Okay? And then in the second half, your job is to solve that problem. So don't mix things, because sometimes people mix, and in the data gathering, they're trying to solve the problem, and then in the clinical management, then they're asking various questions that they should have asked earlier. The second problem here is not keeping track of time. And I think in case 5, this doctor was not very aware of her time, because she kept going and going beyond 12 minutes, and the consultation lasted over 15 minutes. So keeping track of your time is very important. That's the basic. If you don't measure where you are relation with the time, then no wonder you're not going to manage your time well. So in the exam, you will have a timer which is counting downward that you can see, and you can keep track of that. The third point is not priming the case beforehand. So among these two candidates, you can get an idea who actually primed the case better, and it reflects in the way that they're consulting. So I want you to think from an observer's perspective, like an examiner. Which candidate do you think has been priming the case more effectively? Yeah. So you see the contrast when somebody is priming the case, and do you see the time duration of each consultation? So that's why you need to train yourself to do better job at priming your case. It's very important. Remember, the consultation starts before it happens, right? In the 3 minutes you get, you want to utilize it. The other problem is lack of structure. If you're not organizing your consultation, in your mind everything is disorganized, then it's going to reflect in the consultation. It's not going to be structured. Another cause is procrastinating clinical management. So you see, like, I think in both cases, this is very common where GP trainees, they procrastinate clinical management. If they're good at asking questions, they're comfortable staying in data gathering, but don't progress and go into clinical management. You know, clinical management is the exciting part. This is when you get to make a difference in your patient's life, where you can show your skills at how you're solving these problems. So once you've got enough from each of these three buckets we discuss, then make sure that you transition to clinical management and go solve the problem, because that's where you're going to get more marks. So any question on this so far? Let me know if you've got any question or any comments. Have you found it useful so far? Give me a 1 if you found this useful so far. Okay, great. So, very important that we speak about the structure. So, the process is important, you know. So, when you're starting your preparation, make sure that you have a clear process how you go about from starting the consultation to finish. So, how you're priming the case. Give me an example how you're priming your case. So, tell me, what are the three things you look in a case before you start? What are the three things you think about? So, for example, in your practice, when you're going to see a patient, what are the things that you look in the case records? Right, yeah. So there's a lot of good suggestions here. So you want to look various things, previous encounter, what are the medical history, anything that's relevant. You also want to think about the management, what you might need to discuss in that consultation. Most people are very good at priming the data gathering part, but they don't prime the clinical management enough. So, you know, think from the end. Think how you're going to have this consultation ending, how you want it to end, and then work backward, reverse engineer it as in where you are right now. That way, you start thinking about not just differentials, data gathering, but also how am I going to explain, let's say, unexplained medical diagnosis to this patient? How am I going to explain the management for this chronic pain? So that's really where you're starting to think from the end and then work it, reverse engineer it. And that will help you a lot. So if you haven't got a structure, I encourage you to go and watch the consultation framework lesson in the blueprint program. I go over various consultation model in it, and you will learn much more about what sort of consultation framework that's available, and then you can develop your own structure. Because if you haven't got the structure, which is a backbone of what your consultation will run on, then you're going to struggle. Under exam condition, you want to have a framework in the back of your mind so that you can rely on that. Okay? Right. So in this case, when we analyze what needs to happen, I wanted to show you exactly what are the key points here that you need to consider and what should have been done to make sure that this score would be higher. So The problem here needs to be very clear. You have identified clearly what's the problem, and you're showing that you're utilizing the existing information. Take a focused history of the pain, any changes to the symptom over time, explore any relevant red flags. Because sometimes if you're just thinking gynae, you might not think about other things. What if it could be something else going on in this patient's case? And then find out what the patient has tried so far. This is very important, and I think Ziad pointed it out. When you find out what's been tried, then when you're going to discuss your management, you can tailor your explanation based on the patient's circumstance. For example, if you know already they've tried counseling, they didn't find it helpful, then you can tailor your explanation to show them how it could be done or what else could be done. And then also think about the subjective aspect of pain and think about the mental health as well and how is it impacting on their health. So it's important that the patient feels that they are understood and that you get them, because if they don't feel like that, then they might start having judgment that the doctor doesn't feel like I've got pain or it's not real, and it's not going to be easy for you to manage this then. So there are things that you want to make sure that you refine, and this is where active listening is important when you're picking up these cues and you're showing empathy. So communication skills is not just about you talking, but a lot of it is about listening, and the patient is going to remember how you make them feel. Okay, so when it comes to the management here, before you jump into the management, it's important that you aim for a shared understanding. You achieve that shared understanding first, and then you develop your management plan and involve your patient in that. How do you think this uncertainty could have been managed better? Share in the chat box what do you think could have been done to manage this uncertainty in this patient's mind. Any suggestion? So yeah, Yogini said, acknowledge that the tests have not helped the pain. Concern regarding cancer. Okay, so yeah, reassure that this is not cancer. Now, I think the candidates have done that. However, it's still an issue in this patient's mind. And this is where you might get patient who's still asking for more, and it's difficult to know what to do next. So this is where it's important to explain about the limitation of the test and also about how time could tell. If this was cancer and it's been 3 years' time, we would have seen more that would have developed. And actually, this has not developed and evolved. So it's very unlikely. And this would be a way that you could explain to the patient. And explain to the patient, we also know that if somebody keep worrying about cancer and is stressed about it, then this could be an issue to their health as well, and they can develop other problem. So explaining the problem as well, if she's keeping worrying, and how we need to actually help her in that way. So yeah, somatization is a phenomenon, yeah. So you want to educate the patient and offer helpful advice that's practical to the patient. And then consider psychological management as well. So there's also acceptance and commitment therapy, where the patient accept that this is a problem that they've got, and they're willing to work towards getting better and do things that will help her, instead of just thinking like she can't do anything about it, feeling helpless, and just feeling miserable about her condition, which is going to make things worse for her. So then there's also, as we discussed, a possibility of referral to pain clinic. And if you feel that this patient might benefit from specialist input, and then follow-up and safety net advice as well, so that you show continuity, because it's likely that the patient would still feel that there are things that's not been addressed. So she's got a chance to have a chat again if she needs, maybe in a month time. So you see, this is the level of complexity of cases you might get in the exam. So you need to be prepared how to manage these cases. And I think in your practice, you might see some of these hot sink patient, which some patient where they come and come again, and it's very difficult to know what's going on. Sometimes having somebody who listens to them is going to help them, because all the people they've spoken to not really been listening to the problem and understanding them. And if they've got somebody who understands them, then they can break that cycle and start seeing things from a different lens. So to be able to get passing level, what you want to do is to aim for systematic history taking, where you're targeted, you're using the relevant information, and you address the needs of the patient and the problem. The structure is very important. I want to emphasize on that. If you haven't got structure, make sure you go and watch the consultation framework models and write down your structure. So in the data gathering, you want to show you're making a safe assessment, you're thinking about the appropriate range of differentials. And in this case, for example, if you haven't got any causes, then think from first principle that we've excluded life-threatening or any other pathologies, and then think about what we can do to help this patient manage this uncertainty. Then when it comes to the clinical management, it's important to demonstrate that we're managing the problem safely, and discussing appropriate management plan, and also making sure that we empower the patient to manage their problem, as in self-management advice as well. And also showing a commitment for care, not just short-term, also long-term, what you're going to do for this patient long-term. And when it comes to the relating to others domains, it's important that you think from a perspective of a doctor who's caring to the patient, and also patient-centered. So in this one, you would see it's person-centered. So it's even better, because you know how sometimes you're just thinking of patient, but this patient is a person and they've got other things going on. So if you're curious about the other things as well, you might get better out of the consultation, because you build trust with your patient. So having some flexibility and also making a plan according to the patient's preference and involving that patient in the plan is really helpful. Have you found the insights in this video useful so far? If so, you might be interested in SCA Blueprint and mini course. This is a free blueprint that you can get and teaching from myself. Just click the link down the description below and sign up, and you will get a teaching from me every day for the next 7 days. Next part, I want to discuss the listening. So who here feels like they are good listeners? Or who here feels like they struggle to listen? Write in the chat box if you feel you're a good listener or you're struggling, and tell me your experience when you're listening. Okay, so Divya says, I'm a good listener but struggle to empathize with what someone has said. Okay. We'll focus on that, don't worry, about how you can empathize. So Tom says mine is preoccupied or distracted. Helen says struggle to listen when I'm organizing thought process. My head, yeah, that's a common one. So you're thinking about what next to ask, so then you're not really listening. Okay, so yeah, the barriers to listening are when you're distracted. So, there is a discussion in your mind that's going on with yourself. So, if you're having these distractions of the thoughts that's floating in your mind, or maybe you're thinking what you're going to ask next, or you're preoccupied, or you're just not interested, or if you have some prejudices or biases, some of them could be unconscious bias, you don't even know about them, then you're going to listen and selectively listen what you want to hear. So that's an issue. If you're not listening actively, then this is where you might think of something, but actually the patient did not say that, but that's what you've heard. So there are two ways people listen. Most people think of listening as passive, like a sponge. They're just absorbing what the patient is telling them, saying, okay, or just staying silent without interrupting the patient, and sometimes reflecting back to what the patient says. But that's not a really good way of listening. A better approach is active listening. Think of it not like a sponge, but as a trampoline. When you're listening, you actively pay attention to what the patient's telling you, you amplify and support the patient, and ask insightful questions so that you want to find out more about what the patient's told you. For example, when the patient says something like, my friend Claire had cancer, if you're an active listener, you're going to ask a follow-up question and find out more about this friend Claire, because this is not the first time. This is the second time the patient dropped that cue. So you want to ask more about this. By doing that, then you're going to get a better understanding about why this patient is worried about cancer. So there are various levels of listening. Some people are passive listeners. Some people, they listen selectively. Sometimes some of us might even pretend to listen. Then there's attentive listening. Then there's active listening and empathic listening. So you probably do a little bit of each of these. But what you want to do for the exam is doing more of active listening and empathic listening. If you're doing this, then your consultation will get much better, because you'll become a better communicator, and it will reflect in the way that you're consulting and the interaction. So how do you become a better listener? First thing, you want to quieten your mind. So quiet your mind, all these thoughts, all these things that's going in your mind. You want to make sure that there is space for you to listen. Because if you haven't got space to listen, it's already busy in your mind, then it's a barrier to listening to your patient. So when you create that space to listen, then you want to listen open-minded. Be open to what the patient is telling you. Don't try and judge what the patient is telling you. Replace that judgment with curiosity. Be curious about the story, about what the patient's gone through and their perspective. Learn from them. By having that approach, then the next question will come easily. Because you've listened, it will allow you to ask a follow-up question that's insightful. But if you're worried, for example, somebody is taking a history, they're like, question number 1, why have you come here today? Question number 2, what were you concerned? Question number 3, what's your expectation? What were you hoping? So you see, by doing that interrogative approach, you're not going to have a conversational flow. Whereas if you listen, the patient drops a cue, you ask a follow-up question and ask more, then the consultation is going to flow. Does that make sense? Great. Thank you, Tom and Ziad. Okay, so next thing I want to touch on, This is something that I've covered in the Blueprint program. You'll be able to watch this in the, I think it's How to Build Rapport Remotely. Go and watch this. I go in much more detail how you build rapport and empathize with your patient. But I want to share with you what you can do. So to empathize with your patient, the 3 things that you want to do. First thing, you want the patient to be heard. You know, people, they have a craving to be heard. You want them to be heard. Second, you want them to feel that they have been understood. Not just heard, but understood. And the third thing is that you want them to feel that you get them. So they should be feeling, this doctor gets me. So the way you do that is by using a receipt. So if you give a receipt to a patient, then you fulfill these 3 tasks where you make sure that they are heard, they're understood, and they feel that you have got their understanding in terms of you feel what they're feeling. So a receipt is something you give to your patient. For example, patient telling you, this pain is terrible, doctor. I can't go like this. So then you could say something such as, I hear you, Mr. Smith. This pain sounds terrible. I can only imagine how this is affecting you. So you see, like, I'm not just saying I'm sorry. I'm showing that I hear this patient. I understand where they're coming from. And I almost share the experience of pain that they're having. So by doing that, then I will empathize with the patient. The thing is, you can say it, but if you don't mean what you say, it's not going to work. You can't fake it. You have to genuinely be interested and care for your patient to be able to come across as somebody who's empathizing. Okay? So it's not about what you're saying, it's more about how you're saying it, whether you're genuine and you're caring in your communication. Okay, so we've gone through a lot today, and I just want to remind you about the fact that it's important not just to practice and consult, but to analyze your consultation, assess, seek feedback, adjust, and implement. So you see how we analyze these 2 consultations and the depth we went into? Make sure that at some point you analyze your consultation and you look at the transcript as well, because that will give you more insight in your consultation. You might be doing it once, and then maybe you can do it in a month's time to see your progress or what are the things that you need to work on. Okay, so I want to give you 3 actionable steps for today. So make sure that whenever you're going to consult a patient in your practice or when you're revision session, organize your thoughts beforehand. Don't just jump into a consultation, but be intentional. Be conscious what you're doing and organize your thoughts and structure your consultation before you even start. The second thing is be curious. Listen actively to your patient. And the last part, make sure that you analyze your consult, and if you're not using the SCA companion, make sure that you start using it and write down your learning, the reflection, because when you come back to it, you're going to consolidate it, because it's very likely you're going to forget otherwise. So what I want to do here is to ask each of you to share one thing that you've learned and how you're going to implement it. Let me know in the chat box one thing that you've learned from today and what you're going to implement. So Judge say prepping cases and active listening. That's great here. Picking up cues with active listening. So before we wrap this session, I'd like to ask if you've got any questions. If something doesn't make sense, please feel free to ask me. because I want to make sure that you have clarity on what we've discussed today.
Can I ask a question?
Yes.
Okay. When you mentioned active listening, that we should always practice active listening. From what you've explained, it sounds like when the patient is speaking and you're listening actively, you can chip in and ask questions. For instance, if the patient mentioned my friend had cancer and the patient is still talking, probably you want to demonstrate active listening because actually you're listening, but you want to follow up a question immediately. Wouldn't it come as you're interrupting the patient, something like that?
So you can ask follow-up question without having to interrupt the patient. Let the patient finish what they've said, and then you can ask your question. So a follow-up question can come after they've finished their response, and then you ask, you mentioned about your friend, tell me more about what's happened to your friend Claire. You see, you don't have to interrupt them, and most of the time, the simulators, they're not as talkative as your real patient. So they know that they have to give you some time to ask questions. And actually, there are things that they won't tell you until you ask questions before they can disclose.
Okay.
Any other questions? If there's any other questions, please feel free to ask. I hope this answered your question, dude.
Yes, it did. Thank you.
Right, so just to remind you, make sure that you're using the lessons and the modules in the blueprint, because if there are things that today that you felt that there are things that you need to improve, then go and watch these modules and lesson. You can do it at your own pace, okay? And I've added 2 more cases in the case demonstrations that you can go and watch. So thank you very much for taking the time, and I'll speak with you soon. Take care, everybody. Bye-bye.